My name is Diana, and the story I'm about to tell you, the family never wanted it told. Helen Marsh was 46 years old when her mother introduced her to a new neighbor at a backyard cookout in Lakewood, Colorado, and Sandra Marsh said, exactly as she always had, in the same comfortable shorthand she had used for 23 years, "This is my daughter Helen. She works in healthcare administration." Pause. Her brother Craig is in real estate. No further elaboration was offered. Craig's name came with the follow-up, the office in Cherry Creek, the listing he'd just closed, the development going up on the south side. Helen's name came with the category and the period at the end of the sentence. Helen stood with a glass of iced tea and smiled at the neighbor and said, "Nice to meet you," and she did not say the rest of it. The rest of it was this, that the category her mother had filed her under at 23 and never revised covered something that looked, from the inside, considerably different. She was the vice president of operations for a regional healthcare group that managed 14 acute care hospital facilities across 4 states. There were approximately 2,300 people in the organizational structure that reported to her office, directly or through chain of command. She had held that role for 6 years. She had spent 14 years building the expertise that made the role possible. The annual budget that passed across her desk each fiscal year was larger than the GDP of several small nations, which was a comparison she had made once to a colleague as a joke, and which had turned out, on closer inspection, to be literally accurate. She did not say any of this. She finished her tea and helped with the potato salad and drove home at 5:30. On the drive home, she passed a hospital facility she had toured 3 years earlier as part of a regional benchmarking project. She knew its patient capacity, its operational efficiency metrics, the name of its COO. She passed it the way she passed everything in Denver, knowing it fully, moving through it without stopping, and she thought briefly about the cookout, about the neighbor's polite expression, about the way her mother had said, "Craig is in real estate," with the particular ease of someone landing on comfortable ground. She thought this is still the arrangement. She thought, I have chosen it at least as much as they have. She was not wrong about this. That is the part she holds on to. At some point in her late 30s, she cannot pin the exact moment. Though she has tried, Helen stopped attempting to correct Sandra's introduction. The correction, on the occasions she had tried it, produced a recognizable sequence. Sandra would look briefly embarrassed. She would recover into something that resembled pride, but had the hollow quality of an emotion that has been surprised into existence rather than felt into it. And then the next occasion requiring an introduction would come, and Sandra would say she works in healthcare administration because the filing had not been updated and she did not know how to update it without acknowledging that it had been wrong, and acknowledging that it had been wrong would require a kind of reckoning she was not equipped for. This is not a story about a cruel mother. Helen is insistent on this, and she has asked me to be insistent on it too. Sandra Marsh was not a cruel woman. She was a woman who had organized her family into a narrative that made internal sense, and in that narrative, Craig was the legible success, the real estate license, the wife Donna, the house in the right suburb, the 2 children whose milestones Sandra could report at gatherings as evidence of the family's general health, and Helen was the one who had gone complicated early and lived far away and done something that nobody in Sandra's social world had a vocabulary for, and who had never quite returned to the center of the story in any way that Sandra could use. Sandra loved her daughter. Helen has never doubted this. The problem was not love. The problem was that Sandra's version of Helen had stopped updating in approximately 2003, and the person who had kept developing after that point had done so in a register that Sandra could not quite locate on any map she owned. Helen had started in hospital operations as an analyst at 24 in a role that was exactly as unglamorous as it sounds. Process mapping. Efficiency reporting, the internal plumbing of large healthcare institutions that nobody in the building thinks about until the moment it fails, at which point everyone thinks about nothing else. She had a particular aptitude for it. She has never been entirely able to explain this aptitude to people who don't share it, but the closest she has come is this: she could see a complex system as a single organism. She could identify where it breathed easily and where it constricted, trace an adverse outcome backward through a chain of 15 interacting variables to the one point where a correction made at the right time and in the right way would change everything downstream. She had been promoted 5 times in 11 years at her first organization, each promotion moving her further from the process mapping baseline and closer to the place where the decisions that shaped everything else were made. At 35, she had been recruited, specifically and deliberately, by the regional group that eventually gave her the VP role. They were expanding a managed acquisition of several facilities across Colorado, Wyoming, and New Mexico, and they needed someone who could hold the operational integrity of a growing system together under the pressure of that growth. Not just competence. The specific competence of someone who understood that the thing they were holding together had human beings inside it, that the efficiency metrics were downstream consequences of human conditions, that the right intervention in the right system node at the right moment could change patient outcomes in ways that never made the annual report because they showed up as the absence of something that didn't happen. Helen had done that work and done it well, and been recognized for it within the systems and communities where that recognition was meaningful. None of it produced anything her family could hold, no product anyone could point to, no storefront, no listing in a directory that circulated in Sandra's social world, just the steady, careful, invisible work of keeping very complicated things functioning well at a level that most people interact with only when it fails. She was, it turned out, exceptionally good at invisibility. She had always been. The governor's Business Leadership Award letter arrived at Craig and Donna's house on a Thursday in March. It had been sent to an address Helen had used, briefly, as a mailing address while she was between apartments 11 years earlier. She had never fully removed it from one particular mailing list, the Denver Metro Chamber, which had nominated her for the award without informing her in advance, which was standard practice for their recognition program. The letter was addressed to her name. The envelope looked official. It was opened by Donna, who later said she thought it might be a bill that had been misdelivered, though the envelope bore the gold embossed seal of the governor's office on the upper left corner. Inside was a formal citation. Helen Marsh was being recognized for sustained leadership in regional healthcare infrastructure, specifically her role in the integration of 6 facilities over an 18-month period that had resulted in measurable improvements in patient outcomes across a 4-state service area. The letter referenced her title. It referenced the scope of her responsibilities. It referenced, in the dry and specific language of official recognition, exactly what she had spent 23 years building. Donna read it twice. Then she called Sandra. Helen did not learn about this phone call until 6 weeks later, and she did not learn about it from either of them. She learned about it from Craig. Craig called her on a Sunday afternoon in April, which was unusual. Craig's calls were infrequent and generally motivated by a specific occasion, a holiday, or an upcoming event. This call had no occasion attached to it. He called, and there was a brief pause after she answered, the pause of someone gathering the beginning of a sentence they have been rehearsing. He said, "Did you know Mom thought you just did paperwork?" Helen said, "Yes." He said, she was telling people that. Helen said, I did know. Craig, "I've known for a long time." There was another pause. Craig was a decent man, which she has always believed and which she believes now. He was a man who had been shaped by a family story that put him at the center and had never had particular reason to question the shape of it. This was not his fault and not something she has ever held against him as a personal failing. But it meant that the conversation she was having with him on a Sunday afternoon in April was one he was encountering for the first time while she had been living inside it for 20 years. She had watched Craig at family gatherings for 20 years with the specific attention of the person who is always slightly outside the center of gravity. She knew the version of him that her family celebrated, the commissions, the deals, the neighborhood he had built his practice around, and she knew, more quietly, the version that sat across from her at the kitchen table when Sandra's attention was elsewhere, the one who still called her at random intervals when he needed to think something through, who had called her at 2 a.m. when his marriage hit its first serious wall 4 years in, who had never quite stopped needing his sister, even while the family story cast her as the supporting character and him as the lead. They were not close in the way that people who live in the same city and see each other regularly are close. They were close in the way that people who know each other's real texture are close, even across distance. He said, "Donna opened a letter. At Mom's request, she said, but I don't know if that's true." Helen said, "I figured something like that had happened." He said it was from the governor's office. Helen said, "I know which letter it was." He was quiet for a while. Then he said, "You never said anything, Dot." And she said, "No, I didn't." She told him she wasn't angry. She told him the truth, which was more complicated than anger. She had made a decision years ago to stop spending energy on a correction that didn't take, And the energy she had saved had gone into her work, and the work had produced outcomes that were real and documented and completely independent of whether her mother understood them. She had not needed Sandra's understanding to do what she had done. She had needed her own dot. Craig said he was sorry. She believed him. She told him she knew. The history that lay underneath that phone call had been accumulating for a long time, and if you wanted to understand why the letter from the governor's office landed the way it did, not just on Donna, who had opened it, but on the whole architecture of the family's self-understanding, you had to go back further than March, back past the award and the 11-year-old mailing address, and the Thursday afternoon when Donna called Sandra. You had to go back to the specific texture of what those 23 years had actually felt like from the inside. The first time Sandra used the healthcare administration description at a family gathering, Helen had been 26 and had just been promoted to a regional role that tripled her responsibilities and her salary. She had told her mother about the promotion in a phone call that lasted 4 minutes because Sandra had been on her way somewhere and had taken the call on the move. Sandra had said, "That's wonderful, sweetheart. Is that the same company?" And Helen had said, "Yes, same company." And Sandra had said, "Good, good." And then she had said she had to run, and that was the end of it. At the next family gathering, Thanksgiving, Denver, Sandra's house, Sandra had introduced Helen to a family friend as, "This is Helen. She works in healthcare." The specific promotion, the specific scope of the new role had not been retained. Helen had let it go once. Twice. By the third time, she understood that the introduction was not going to self-correct, and she had tried the explanation, and the explanation had produced the empty pride, and she had understood then that what she was dealing with was not a gap in information, but a gap in framework. Her mother did not have the mental model required to hold what Helen's career actually was, and providing more information only produce more instances of the empty pride. She had stopped trying to build the model. She had started, instead, building other things. The other things took the shape they took. She had been 31 when her first major integration project, 3 separate hospitals in the Colorado foothills being brought under a single operational structure, was completed on schedule and under budget, a result that generated a 2-line mention in a healthcare industry newsletter and a formal commendation from the organization's board of directors. She had been 34 when she identified a systemic flaw in the patient discharge protocol across the organization's 6 facilities that, once corrected, reduced average length of stay by 11% and freed approximately 40 beds per day across the network, the equivalent, in operational terms, of building a new wing without constructing anything. She had been 37 when the regional group recruited her, and 38 when she took the VP role and began the process of understanding what it meant to hold, in both hands, the daily functioning of a system that touched the lives of roughly 900,000 patients per year. None of this appeared in any conversation at Sandra's kitchen table. The board commendation had come and gone without mention. The discharge protocol improvement had not made it into the family's awareness at any level. The recruitment to the VP role had been conveyed in a phone call, during which Sandra had asked whether the new position meant she would need to move, and Helen had said she was already based in Denver, and Sandra had said, "Oh, right, of course," and the conversation had moved on to Craig's new listing in Cherry Creek. Helen had sat with the phone in her hand afterward, and she had looked at the wall of her office in Denver, and she had felt not bitterness. She has been specific about this. She does not think the emotion was bitterness. Something closer to the specific sadness of realizing that a door you had been trying to hold open has finally, quietly closed. Not slammed. Just closed. The way doors close when no one is pushing them anymore and the air pressure on both sides equalizes. She had gone back to work. The VP role had required everything she had in the first year, which was approximately what she had expected, and the requirement had been useful. It left very little space for grief about things that were not workable. She had been 41 when the regional group made the decision to expand it into southern Colorado, and she had spent 18 months navigating the acquisition of a facility there that had been, by most assessments, in a state of operational disrepair that would have taken a lesser organization 10 years to address. She had addressed it in 22 months. The facility's patient satisfaction scores, which had ranked in the lowest quartile for the state when they acquired it, had moved into the top half within the first year and into the top 10% by the end of the second. This was the work she had referred to in the governor's award citation, the specific accomplishment that had prompted the Denver Metro Chamber to put her name forward for recognition At the awards ceremony held in March at the state capitol in Denver, she had been seated at a table with 6 other honorees and had received her award from the governor's chief of staff, who had read the citation in full, including her title and the scope of her organizational responsibility. There had been a photographer. There had been applause. She had stood at the podium for 90 seconds and said the things that were true, which were that the work was not hers alone, that the people in her operational structure were the ones who had made the outcomes possible, and that the visible recognition of invisible work was one of the better things an institution could do. She had gone home afterward and had dinner alone at a restaurant in Capitol Hill and had thought about calling Sandra and had decided not to, because calling Sandra to tell her about the award would have required explaining what the award was, and explaining what the award was would have required explaining what she did, and she was 41 years old, and she had stopped doing that. At some point she could no longer identify, and she did not want to start again at a dinner table on a Wednesday evening, after a ceremony she had been genuinely pleased to attend. She had taken a photograph with her phone at the Capitol building, the specific light of a March evening in Colorado, and she had put the phone back in her bag and finished her dinner and gone home. The letter had gone to Craig's house by accident. Everything that followed had been an accident too, in the technical sense, not planned, not engineered, not something she had arranged. She had not tried to manage the outcome. She had simply stopped preventing it. Donna had joined the family 8 years into this arrangement, when she married Craig at a ceremony in Aspen that Sandra had organized with the specific thoroughness of a woman who had been waiting a long time to plan a wedding and was not going to underplan it. Donna sold insurance. She was competent at it and relatively successful, and she had the specific quality of someone who equates financial literacy with financial success, and both of those with general intelligence, which is a common conflation and not always a cruel one, but which, when directed consistently at a person whose actual financial position is significantly better than your assumption, produces a particular kind of friction. Donna had, across 8 years of family gatherings, offered Helen career advice twice. She had commented at Thanksgiving 2019 on the importance of owning something rather than working for someone else. This directed not explicitly at Helen, but in a way that included her clearly in the radius. She had, at a 4th of July gathering 3 years later, made a remark about the security of having a product people could understand, as opposed to service roles that could be restructured overnight. Helen had heard these remarks in the way she heard most things. She had filed them accurately and responded to none of them. She had not corrected Donna. She had not offered the counter-information. She had considered, both times, whether the information would help, and both times had concluded that it would not produce what she might have hoped, that the information would land in Donna's existing framework and be processed through it and emerge, if it emerged at all, as something that confirmed what Donna already believed rather than revising it. She had also considered, and this is the part she is more cautious about naming, that there was something she did not want to give Donna. Not the information. She has no attachment to keeping her professional life secret from family. What she did not want to give Donna was the specific authority that comes from being corrected. The dynamic of Donna offering career advice and Helen responding with the actual picture of her career would have been, she is honest about this, a confrontation, a small one. Contained one, but a confrontation nonetheless, and she had decided more than once that the confrontation was not worth what it would produce. She had wondered, after October, whether that was the right calculation. She had wondered whether 23 years of not confrontations had produced a silence that was its own kind of problem, not for her career, which had proceeded without any of their understanding, but for something more personal. The possibility of being known. She is still considering this. She had eaten the turkey and the potato salad and driven home and gone back to work on Monday. The work that Monday had included a scheduled call with the facility directors in Wyoming about a regulatory review that was coming in spring, a review of a staffing model she had commissioned 3 weeks earlier, and a decision about the timetable for a capital equipment replacement across 2 facilities that had been on her desk for 6 weeks and needed to be made. She had made it before noon. She was, by any objective measure, one of the more effective people in her professional world. She had quantifiable evidence of this. She had the commendations, the outcome metrics, the peer recognition, the award from the governor's office. She had the specific knowledge of her own competence that comes not from believing you are good at something but from watching, repeatedly, as the things you do produce results in the world. She had also, for 23 years, been introduced at family gatherings as someone who worked in healthcare administration in a tone that communicated she chose a safe, unremarkable path, and we love her anyway. She is not interested in sympathy about this. She has said that clearly. What she is interested in is precision in naming the thing as it was, not softening it into something more palatable. The softened version is, her family didn't fully understand her career. The precise version is, her family had built a story about who she was, and the story didn't include the actual person. And she had allowed this to continue for longer than she needed to, because the correction required an energy expenditure she had decided not to make. Both the softened version and the precise version are true. The precise version is more useful. The work, at that point, included a merger integration she was managing across 3 facilities in New Mexico, a staffing restructure in 2 Wyoming locations, and the early planning stages of a facility in southern Colorado that would eventually become the largest hospital in the region's network. None of this was visible to Donna. None of it was required to Bede. There was one more incident Helen returned to, more than the others, when she thought about what had accumulated across those years. It happened at a family dinner in the autumn of 2021, when Sandra had mentioned in passing that Craig and Donna were looking at refinancing a property and had been speaking with a financial advisor about structuring the equity. The conversation had turned, as conversations in Sandra's kitchen sometimes did, to the general topic of investments, of building something, of the difference between people who moved money well and people who didn't. Sandra had looked at Helen at one point and said, "You should talk to someone like that, sweetheart. Someone who can help you think about the future." Helen had a financial advisor. She had had one for 14 years. The assets under management were not the kind of number she discussed at family dinners or anywhere else. She had a retirement portfolio, several investment accounts, and a property in Denver's Highland neighborhood that she had purchased 8 years prior and which had appreciated in a way that her financial advisor described as exceptional. She had said, "I'll think about it, Mom." She had helped clear the table and driven home. She did not think Sandra was performing cruelty in that moment. She thought Sandra was genuinely concerned in the diffuse, persistent way she was concerned about Helen generally, that Helen worked too hard at something she didn't fully understand, that Helen lived alone in a city that wasn't home, that Helen had not done the things that would have made Sandra's worry unnecessary, which in Sandra's framework meant a husband, and something simpler. The concern and the dismissal were not separate things. They were the same thing, seen from 2 angles. Sandra's 65th birthday party was held on a Saturday evening in October at a hotel ballroom in Lakewood. Sandra had not planned it herself. Craig and Donna had organized it, which meant Donna had organized it, and she had done so with the particular thoroughness of someone who wanted the event to reflect well on the people who'd arranged it as much as on the person being celebrated. There were 73 guests. There was a catered dinner. There were speeches. Helen flew in from Denver on Friday evening and stayed at a hotel 2 miles from the venue because the house was full and she preferred, at this point in her life, to have her own space when she returned to events that required a certain amount of social management. She arrived at the party at 6:30 and moved through the room in the way she moved through most rooms, efficiently, without hurry, with the specific quality of attention she gave to everything, which was complete and genuine and not performative. The man who approached her at 7:15 was named Richard Holbrook. He was 62, white-haired, and had the contained, organized manner of someone accustomed to running things. He introduced himself to Helen as a former colleague of Sandra's from the hospital where Sandra had worked in dietary services for 11 years before her retirement, which was a part of Sandra's history Helen was aware of, but had not thought about in the context of this evening. Richard Holbrook said, "I recognize your name from the Regional Leadership Conference last spring." He paused. "You spoke on the integration panel, the New Mexico facilities." Helen said, "Yes, that's right." He said, "I'm the Chief Operating Officer at St. Andrew's Medical Center." He named a hospital that was, at that moment, one of 14 facilities in Helen's operational portfolio, not one she managed daily, but one that appeared in her organizational structure and had, in the previous fiscal year, been part of a staffing review she had overseen. She said, "I know St. Andrews well?" He said, "I imagine you do, given the scope of your portfolio." He said it with the easy acknowledgement of a peer who understood the territory without needing it spelled out. He said, "Your restructuring recommendations from last year's review had a real effect on our surgical scheduling." "I wanted to say that directly," Helen said. "I'm glad to hear it." Richard said, "Is Sandra?" He gestured at the room. "Are you related to Sandra?" Helen said. "She's my mother." He was quiet for exactly one beat. Then he said, "I had no idea." "She never mentioned." Helen said no. She wouldn't have. At that moment, Donna appeared at the edge of their conversation, drawn by the particular social radar she had for guest dynamics, and she looked at Richard Holbrook and then at Helen with the expression of someone who is reading a social situation and finding that it doesn't parse against the template she brought in. Richard Holbrook said to Donna, "You're Sandra's daughter-in-law?" "Helen was just telling me she's Sandra's daughter." He said it with the specific warmth of someone at a party who is filling in a social gap without knowing there is a gap to fill. He said, "You must be proud of her. What she's built at the regional group is genuinely remarkable." Donna said, "Yes, of course." Helen watched her say it. She watched the specific flatness behind the performed agreement, the quality of a person who has been handed information their existing framework cannot process, and who is covering the processing time with the only available word. She did not feel satisfaction. She has been careful to be honest about this when she tells it, because the easy version of the story puts satisfaction here, puts the vindication moment here, and she does not think the truth of what she felt was satisfaction. What she felt was closer to tiredness. The tiredness of a thing that has been a long time coming and has now arrived and must be managed. She excused herself at 8:40 and went to find her mother. Sandra was at a table near the center of the room, surrounded by friends from her garden club, and she looked up when Helen sat down beside her with the specific brightening she had when Helen gave her undivided attention, which Helen tried to do at every visit, which Sandra received each time as a gift that surprised her, as though she had not fully expected it. They sat together for 20 minutes. Sandra talked about the party, about the friends who had come, about the flower arrangements that Donna had organized. Helen listened. She did not bring up Richard Holbrook. She did not bring up the letter or the award or the conversation with Craig in April or the 23 years of healthcare administration. She sat with her mother at her mother's birthday party and was present for it in the full sense of the word. And at the end of the 20 minutes, she kissed Sandra on the cheek and went back to the party. She flew home Sunday morning. She was at her desk in Denver by 2 in the afternoon. The week after the party, she had 3 facility director meetings and a board presentation. The board presentation was on the capital expansion in southern Colorado, the second phase of a project she had been building for 4 years. And it went well, the kind of well that is less dramatic than a success and more reliable, the kind that comes from preparation deep enough that the questions don't surprise you. She had answered every question fully and without notes. The board had approved the next phase unanimously. She had thought, on the drive home from the board building, about Richard Holbrook and the expression on Donna's face, and the way Sandra had looked at the headshot photograph on the wall of her living room during Helen's last visit, with the particular quality of someone who is learning to read something they have held for a long time without ever quite looking at it. She had thought, it is strange that this is what it took. A letter sent to the wrong address 11 years after she moved. A former colleague of her mother's at a birthday party. A conversation at a catering table. It had not required the integration project, or the board commendation, or the discharge protocol, or the facility in southern Colorado. It had required a party and a coincidence and a man who recognized her name from a panel discussion and said so. She did not know what to make of this. She still doesn't, it seems, when she examines it, like both too much and too little, too much coincidence to be inevitable, too little intention to be satisfying. It simply happened the way most things simply happen, at a time when it could happen, and in a way that had consequences. She has decided this is enough. She does not need the story to have been built more deliberately to have meaning. It has the meaning it has. She is the person she is. Sandra uses the new introduction. The photo is on the wall. It is, in the accounting that matters, more than sufficient. After October, things shifted. Not dramatically, not in the way that makes for a clean ending to a story. Sandra began introducing Helen differently. The new introduction was not wrong, exactly. It included the right words now, the correct title, the scope of the role. But it had a quality that Helen could identify and that she would describe, if pressed, as performed. The pride in it was real enough, she thought. But it was the pride of someone working from a script they had been handed rather than speaking from knowledge they had accumulated. And the difference was audible to Helen in the specific way that differences are audible to the person who has spent the most time in the room. Donna's career advice stopped. This was the most concrete change and the one Helen noticed most quickly because its absence left a particular kind of silence in the register where it had been. Donna was not unkind. She was simply recalibrated, and the recalibration showed in the careful quality of her social interactions with Helen, the way she held space for Helen to speak in conversations about professional things rather than moving to fill the space herself. It was an adjustment, and it was genuine, and it was also not the same as understanding. It was the behavior of someone who has discovered they were wrong and is managing the consequences of that discovery without having done the deeper work of knowing why. Helen does not begrudge her this. The work is hard and it takes time, and not everyone is equipped for it at the same pace. What Helen holds, still, is something more specific than either the vindication or the change in Sandra's introduction. It is the memory of 23 years of introductions that told one story while she was living another one, and the question of what it cost to let that continue, not in terms of anyone else's behavior, but in terms of her own. The energy of staying invisible when she didn't have to. The discipline of not correcting what she could have corrected. She asks herself, sometimes, whether the decision was right, whether the version of her career she built in the space that silence created was better or worse than the one she might have built inside a family that saw her clearly. She does not know the answer. The question has no clean resolution, which is where she has come to rest on it. She goes home 3 times a year. She sits on Sandra's back porch in the summer and drinks the iced tea her mother makes, which is too sweet in exactly the way it has always been, and she watches the light change over the yard, and she thinks this. This is also part of it, the porch and the tea and the yard. The mother who loved her with everything she had, which turned out to be a more complicated thing than either of them fully understood. Sandra is 70 now. She has a photograph of Helen on the wall of her living room, the professional headshot that ran in a trade publication the year before last, and she points it out to visitors with the specific pride that has now become genuine, the pride of someone who has had time to close the distance between the introduction and the person who has done the slower work of revision. It is not a perfect resolution. Helen has not asked for a perfect resolution. What she has asked for, finally, is a simple thing to be introduced as herself. Now, the cost of the years before now is something she carries quietly and without complaint, which is characteristic of her. She does not dramatize it. She does not ask for anyone to acknowledge it. But when you push her, when you ask her directly what those 23 years of invisible achievement actually cost her, she answers without hesitation the time. Not the professional time which she spent well, the time with her family. The specific accumulation of Sunday dinners and holiday gatherings and back porch conversations during which she was present in body and absent in the fuller sense. The sense of being fully known by the people at the table with her. You cannot get that time back, the conversations that could have happened and didn't. The version of herself she might have brought into the room if she hadn't decided, sometime in her 30s, that the room wasn't ready for her. She does not know if the room would have been ready then. She suspects not. She thinks the timing was what it was, and that the particular convergence of a misdelivered letter and a former colleague at a birthday party was probably as likely to produce the revision as anything she could have managed deliberately. She is a person who deals in systems, and she knows that systems change when the conditions for change accumulate. The conditions accumulated. The change came. She has made her peace with the timeline. It took longer than she would have chosen. It is the timeline she has. There is a question this story carries that I want to leave with you. Not about families exactly, though it passes through families the way most things do. It is this: how many years did you spend in a version of yourself that someone else had written, because revising it felt like more trouble than it was worth? How long did you stay inside a description that didn't fit, because the person using the description loved you, even if they didn't know you? Love is not the same as vision. A person can love you completely and see you partially. Both things can be entirely true at the same time. The question is not whether they loved you, it's whether, and when and how you decided that being seen was something you were allowed to want. Helen waited 23 years. She has not said this was the wrong choice. She has also not said it was easy. If you've lived something like this, you don't have to explain it to anyone. But if you want to, I'm here, I'm Diane.